Good morning, everyone. Today I'm going to talk about right hemispheric stroke and left hemispheric stroke. So, a lot of the time it gets confusing when a question asks you term right hemispheric or left hemispheric instead of left or right side of brain. And also there are some confusing terms like hemisphere, hemiparesis, hemiplegia. So, first of all, I want to go over these terms. Hemisphere. What is hemisphere? Is one side of brain that we can say in general, or one side of cerebrum. Cerebrum is the largest part of brain, and it's divided into two lobes, right lobe and left lobe. So hemisphere means half of cerebrum, or you can say one side of the brain. So when a question asks you right hemisphere means right side of the brain. When question asks you left hemisphere, then it's left side of the brain. Then hemiparesis is weakness on one side of the body. Hemiplegia is more severe, is paralysis on one side of body due to stroke. Now patient with the right hemispheric or left hemispheric stroke, they will have different kind of sign and symptoms. Patient with right hemispheric stroke, they will have left hemiplegia or left hemiparesis, means they will have weakness or paralysis on left side of the body because our lobes of brain they control opposite side of the body. So patient with the right hemispheric stroke, they are not aware of their limitation, they are in kind of denial, and they are very impulsive, they have impaired judgment, and safety is the big issue. So why this happen? Because right side of our brain is mostly associated with our nonverbal memory, spatial awareness. What that means, our ability to judge distance, size, how our body relate to object and space around us. So if patient has poor judgment, so they might hit somewhere, they will try to get out of bed because they are not aware about their deficits. So safety is always a big issue with patient who have stroke in right hemisphere or right side of the brain. On the other side, when patient has stroke in left hemisphere or left side of cerebrum or brain, then their right side will be weak, means right hemiplegia or right hemiparesis. Hemi means right side weakness or right side paralysis. But these patients, they are completely aware of their deficit. They can have communication problems. Why? Because left part of our brain is associated with communication. So left part of our brain also controls speech processing and language. So these patients will have problem with reading, writing, language, and they will be slow at performance, and they will get easily frustrated because they have hard time forming the words or hard time receiving the meaning of the word. Since our Broca area and Wernicke area, they are located in the left lobe of the brain. So Broca area is expressive area and Wernicke area is receptive area. So both these area will be affected when patient has stroke in the left hemisphere. So that's why these patients will have hard time with language, hard time with communication that we can call aphasia. And they will get frustrated easily, they will be in depression. So now let's practice question. So you can get question like this. A nurse is assessing a client who experienced left hemispheric stroke. Which of following are expected findings? Select all that apply. First, impulse control difficulty. Second, poor judgment and denial about deficit. Third, impaired math skills. Fourth, depression and anger. Fifth, loss of depth perception. And sixth is hemiplegia of right side of the body. So first of all, let's look at what side of the brain is affected. It's the left side of the brain, left hemispheric stroke. So then opposite side of the body will be weak. So then our last option F, hemiplegia means paralysis of right side of the body is correct. Then we know that patient who has stroke in the left hemisphere, they have hard time with reading, writing because our left side of the brain control logic and language. So we eliminate first one, that's impulse control difficulty, that is with right-sided stroke. Poor judgment and denial, that is also with right side of stroke because patient with right-sided stroke they are in denial, but patient with left-sided stroke they are aware about their deficits. Impaired math skill, that's part of language or logic. So that will be with left hemispheric stroke. So that's correct. Depression and anger, this will be with patient with left hemispheric stroke because they are aware about their limitation, they are aware about their sign and symptoms. Loss of depth perception, this is with right hemispheric strokes. So our correct answers are C, D, and F. Thank you for watching.